somebody teaching like how they're cooking and what they're doing, and that how they lost weight. You know, having smaller portions. I've been walking every day in my village, so that's what we want to do. So when we get that video person that wants to come and live here, and I go, I'm good at videos, but which I'm free. So that was the plan, and it's still the plan at some point. But until then, we just play these things and things you find on YouTube and worship videos and cartoons and the Jesus movie. So that's all I got for now. But I think it would be great for them to see people from their own mountain cove talking about their health and medicine and how they change their lifestyle to improve their health.
So, can we take a look at your X-ray and ultrasound?
We cover it. We cover everything. It's okay, I'll uncover it. Doesn't
We were limited by the weight, size. This happens to be just as. Sometimes we get machete cuts, so hands and feet. We can do all the way up to the shoulder. For smaller kids, if they have any lower respiratory problems, you know, that we're looking.
Yeah, it's just this big.
Yeah, we can take a shot of the chest, you know, looking for lung. That's really what we were hoping for, and it works. It has worked several times. Sometimes it's so obvious, like it's broken. You can feel the bone. Nobody has to tell me that. But just every now and then somebody takes a kid falls and it's swollen. Not sure if I should just cast it, send the baby home or the kid home, or if I should, you know, bring it in, send it into the city, send the baby into the city, make sure everything's good and well.
Good.
So that's what this.
Well, the pharmacy's right next door, and that's where some of the cool air is just being pumped in by a little fan just to keep this kind of dry.
So the beginning of
it has leaks really bad. So precautions.
The beginning of 2015, we were certified to deliver babies.
Okay.
We are exercising a criteria because it's just because of of our personal limitations. We want to be able to deliver the 80%, that everything is good and well. It used to be that mothers would deliver at home, and so if a lady has already delivered, has already had a normal delivery, so at least one. If she's older than 20 and younger than 35, and she has had at least 4 prenatal visits with us, has all the tests, HIV negative, PDRL negative or non-reactive, everything looks good, the size of the baby is good and well positioned and orientation, that's what the ultrasound machine would just take away any of the unknowns.
Sure.
Then we give her the green light, and we do that towards the end of it all, so that when it comes time, we can deliver the baby, and there should be no surprises. Every now and then we'll have cord, you know. We've not had any knots yet, but so everything comes out nicely, and we're able, I think we're at number 16 or 17 since we've done that. We've had just about as many that we should have delivered, but we're on the road doing different things.
Twice as many that we missed because we weren't here, because we were going to pick up a group, or went down to La Ceiba and he said, just bring them down, I'll meet you at the hospital here. So we just can't be here 24/7. But
Not yet.
If we were,
Someday.
yeah,
We're working on that.
We have about 35 babies right now. So it is what it is. And we tell them, they have our phone numbers, and sometimes we tell them, like, we're going on a trip, please have your baby before, and some of them, they're here trying to have their baby, and Mark goes, you are not ready yet.
One of the things that I think is so beneficial, so the prenatal visits, we want really to exercise the best quality prenatal care for the mothers, because when we are able to deliver, we just pour love to that lady, you know, and that child, and we believe that God's doing some supernatural things, just delivering that mother, delivering that baby, but spiritually delivering that family or that baby and the future of that family from poverty, from so many other things, you know, that come down through family generations. When we can't do that, then we advocate for the mothers at the hospital. And they have told us that when that advocacy really works, that they feel they are represented by our hospital. Even though we may or may not be there, when we're not there, we say, listen, can we, and there's a term in Spanish, you say recommend somebody, which in English may not have any significance, but in Spanish it's very significant. When I recommend you to somebody, they're almost your representative. So that's what happens a lot of the times. So we have people there that are very mindful of what we do here. So when we recommend that patient to that person, they're very well taken care of, way beyond what if somebody just walked in without any representation. So that advocacy really helps them.
That's
And
great.
so that promotes prenatal visits, that promotes institutional deliveries, you know, so mothers and children are being, you know, they're taken care of in the hospital. And to us, something like that really is a big step for the whole Cuenca. So morbidity, mortality, and mother and child, that's gone down. I think we're still having around 0. I have not heard of any fatality associated with deliveries. We've had something before, gestational anomalies that happened, but that's really been improved. So we're very happy for that.
And the visiting the OBGYN, the Samaritan's First Doctor, she was showing me where everything went, so I just like recorded it because Tabby wasn't here. So we plugged everything into the pregnant lady and it just worked beautifully.
Oh, that's awesome.
So now we just need someone to come in labor that the baby's not crowning, so we can actually use the fetal monitor. And so this is the fun. It's like it's a new toy. We actually can do it without having to use the handheld ultrasound, which is what we're doing now. And if things get kind of crazy in the room, and I'm the one holding it, it's never a good thing for the accountant to be in charge of the ultrasound. And he goes, "That's not the baby's heartbeat, that's the mother's." I don't know the difference. So this is great. This is great when it's just the three of us.
So years ago, when we were thinking of and planning on what we were gonna be doing, I really thought that this was gonna be the biggest challenge, because you can go to work, you're a garden worker, and everything depends on the tools you have. If you're a woodworker, you could be the brilliant, but if you can't execute, then you know that's just as good as you can be right there. I really thought that pharmaceuticals was going to be the biggest challenge. How were we going to keep the best pharmaceuticals, making them available, you know, with the widest array, first choice, second choice for any of the infection. And I believe that God really came through with relationships, institutional relationships, churches, universities, you know, our alma mater. That really has come into play. And so we divide up and we tally, you know, last year's how much we used of anything that you have here, and then we make available those numbers to institutions that want to help us. And so they pretty much, girls can give you a little bit more details on that.
Well, it's our teams, so we know how many medical teams we have coming each year, and we divide all the medicines needed between those 5 to 6 teams. And we say, can you bring a fifth of our medications? Here's the list, and we'll figure out the order for you. We'll actually get on Blessings and fill out the order for you, and just leave the part that needs to be paid for you, and then they pay for it. So they do the fundraising through their team, and they bring a fifth. Each team will bring a fifth or a sixth of the medications. And then Lee University, because they come 2 weeks, they're only a 2-week team. They bring 2 portions. And so they actually, they bought the fetal monitor for us, like whatever they had left from their summer studies, their program of students for that term, the university allows them to spend that money for any gift they want for the hospital. So this year they bought the fetal monitor, and various things, the washer and dryer for the hospital. They funded our front gate because the water was rushing in and we had to build it higher than the road. So that was a construction project because it was flooding the property in the rainy season. And they just said, "What do you need?" I said, "Can it be construction?" They said, "Whatever you need to make the hospital run better." And I said, "We need a new front gate." And it was quite a construction feat to get that thing raised up and the ramp down, and just to get the ground higher than the road, so it wasn't a river rushing in the front. And so they funded that. So our teams will do that. Our teams will come with all the medications and then still say, "We have a little left in our fund. What do you need?" And one church, we said, "We need a generator because we can't do surgeries without a generator because the lights go off all the time." So one church did the generator. So that's basically everything medicine comes from those teams, those medical teams. And we have a few government medications that we get because we have a government number and we're both public and private institution. So we get a few, maybe
Mostly birth control,
Yeah.
a few antibiotics here and there.
maybe 10 medications or less.
Yeah.
The injectables.
I see the IDA stuff, so I figured
Yeah.
that's not a team donation.
Yeah, I think
But
The Ida actually comes with the Blessings International.
Oh,
That's
does it?
from
Oh,
Blessings.
so they buy it from,
Yeah.
okay.
Yeah, so that's from
They buy it
Blessings.
from IDA. Good.
Right, now we can go to the back.
Okay.
Old dental missionaries. Platinum or I don't know, some other precious.
Yeah.
We just don't get that many of them, you know. But this thing is, all of this equipment was donated by Korean American Christians that are partners with us in Central Florida. And yeah, this was from a family, the Yoons,
Mhm.
and they bought it there, refurbished it, packaged it, shipped it, and then had somebody come and set it up. So they were.
So she's a dentist and her husband's a medical doctor. So she sent her husband, made him come and install it, and her son that's a dentist, and she said, this is your mission, you take care of the hospital. You go and you take our guy that fixes our equipment, installs, and you take him with you and pay his way and go install the equipment. So that's what they did.
That's
And we
terrific.
brought it.
Yeah.
That's
I just
amazing.
wish we used it more.
Yeah.
But we don't have a
So
lot
when
of
dentists
that
come and you know, the word gets out that we have a dentist present for the week long, whatever, he's the busiest, or he or she, they're the busiest. They'll see
That's
10.
not good advertising for actually getting them here.
Then we advertise, we put it
But
in
yeah, look at the AC.
Please come so we can work
There's
to
a
death.
there's a
Soda machine.
soft serve ice cream thing in here, a massage.
Yeah. Well, is that the need is so great,
Yeah.
and we have the fewest amount of anything we have that come is dentists.
Yeah.
And the need is, you could have as many dental patients as you have medical patients, if you had the dentist with a
But they
medical
take
patients.
longer per patient, you know.
Sure.
Numbing,
Yeah.
extraction, afterwards.
So we'll have 3 to 4 medical providers, we could keep busy 3 or 4 dentists, that's how many people needed to taken care of. So this is set up so that they could do fillings and restorations rather than just pull teeth.
Yeah.
When we go out on the field, we take the portable chair and they just pull teeth, all they can do is pull. But if they work here, so we usually have them here one day, and then if they do stay here another day, we get kids from the school across the street, the high schoolers, and we say, pick your 20 worst cases at the high school, and they have them already selected and ready, the kids that have painful teeth, or front teeth that have cavities that can be saved, instead of pulling all the front teeth and putting that fake bridge in, they set those up and the dentist will work here all
That's
day
awesome.
just with high school students.
So we need dentists, guys.
Desperately.
Desperately.
With a soft serve ice cream, chocolate and vanilla, that's all I have.
And air conditioner. Yeah, we had to put that in because this is such a hard job and they're bending over the patients, so they were just dripping onto the patients. And they were exhausted at the end of the day because it's just that pulling and that pressure on the tooth. And so people were like, why the dentist? And it's freezing because it's way too big for this room. It's from Samaritan's Express actually. It's way too big for this room, but it just makes it ice cold in here. But they're not so exhausted at the end of the day because their job really is harder than anybody's.
Yeah.
Just the force, the pulling teeth. Strong teeth here. Rotten but roots like this long. And it's like, hold on.
So this is our procedures room. We've had a couple of heavy trauma, a couple of castings that we have to do, but really the majority of the time is to bathe babies. And one of the local beliefs.
So like we should like rename it to
Yeah.
baby bathroom because that's what we use it for all the time is because it's the only room with water.
Frequently, mothers believe that if a kid has any kind of cough, any kind of upper respiratory, lower respiratory, or a fever, it should not be bathed. It'll quickly become bronchitis or pneumonia. And so here they are feverish, they're sweaty, they're stinky, diapers and all that.
And wrapped up in blankets.
Wrapped up and sweating. So they have a fever, wrapped up, and just burning up. So I asked Wendy, we'll give that kid a bath. And besides that, we actually dress them to a complete new outfit for them. And that's what makes the biggest difference. Trying just a slow transition.
Yeah.
The mother's not wanting to
Lotion
bathe.
and powder.
Yeah, so we give them a good bath, lather them up in good lotion, and then I'll show you our ministry room over here.
Okay.
Because at first it used to be like, they're killing my baby, they're bathing that baby. It's got a fever or a cough or whatever.
Yeah. So these are,
Ministry rooms.
we did not have a unique name for them. It's the stuff, because it was a closet, and it's the stuff that we give away. but it's hidden because it's only given out in the exam room or it's a private gift. And so this is how we encourage them to come back. And this is how we encourage pregnant mothers to get their prenatal care, because after they have the baby, they get a 5-star bag. They get a baby bag with a blanket and cloth diapers and outfits and shampoo and everything for the baby.
5-star bag for the mother.
That's the other.
Sorry. 1-star bag for the mother.
That's the baby bag.
5-star bag.
bag for the father.
Poor Martin. He never comes in this room. He just asks for things and we go get it. So that's when the baby comes back. So at 10 days, so to get them to come back for a checkup when the baby's
Let me
10
see that
days
again.
old, they get this gift bag. So at 10 days, they get this. And then when they come back for, I think you got a